Good morning, Doctor. Thank you for being with us.
It's my pleasure. Thanks for having me.
Doctor, could you speak to us about the flu and why it's particularly important this year for families to help protect themselves in light of COVID-19?
Yeah, so the flu is a highly contagious respiratory virus. It comes to us every winter season, and it really takes a toll on us in the United States as well as around the world. Last year, 56 million Americans were sickened with the flu, and sometimes it's much worse than that. And people often will require going to the hospital, and unfortunately many people will ultimately die of complications of the flu. And so that surge in health demand, coupled with what's happening in our communities with the ongoing COVID-19 pandemic, really puts an incredible strain on doctors' offices, on emergency departments, and on hospitals. And so it's up to us to do what we can to try to reduce the risk of flu.
Mm-hmm. How can people help protect their families from the impact of flu?
Yeah, so there's the day-to-day practical things we're already doing for COVID-19. Wearing your mask will help prevent the same droplets that will transmit flu, washing our hands frequently or using sanitizer, and if you're sick, staying away from others, and if others are sick, keeping them away from you and your family. But the primary means is to get the flu vaccine. The CDC recommends flu vaccine for anyone 6 months of age and older. There's an injectable version as well as needle-free options, and that's part of why I'm partnering with AstraZeneca to help get out the message.
Mm-hmm. Well, there are a number of misconceptions about flu vaccinations, Doctor. Can you dispel some of these common myths for us?
The one I hear the most frequently is people have concerns that the flu vaccine causes symptoms of the flu. The flu vaccine is made from only a fraction of the proteins in the virus, and we give it very early in the season. So in September and October and November. The virus itself doesn't circulate until later in December and then usually January, February, March. So if someone has symptoms around the time they got vaccine, it's because of other viruses that circulate, like the cold virus and the RSV virus, and not because of the vaccine itself.
Interesting. So what should people do if they're hoping to follow this advice and get a flu vaccine?
Yeah, so people can get more information at prepareforflu.com, but they should call their doctors and discuss if they can get vaccine in the doctor's office. If that's not an option or may be a delayed option, they can look at retail pharmacies and urgent cares and public health clinics. All of them should have vaccine available. And I would also stress that many employers are offering vaccine not only to their employees but their families as well. So there should be many options for people to go and get vaccinated.
So in closing, Doctor, what are you hoping people will take away from this information today?
So I think I would urge them to take action. I would frame it so all of us have close friends, neighbors who may have medically complex conditions, heart disease, lung disease, cancer requiring chemotherapy, who would suffer severe consequences if they were infected with the flu. And so getting yourself vaccinated is not only about you and your family, but it's about all those around you that you treasure. And so it's up to us to do what we can for not only us, but for them too.
Excellent. And this is such good information. We need to be reminded. Thanks again for being with us, Doctor.
It's my pleasure. Thanks for having me.
You bet. Bye now.
Bye-bye.